here today to discuss with you the type of support that you may need regarding your shoe wear, depending on the type of foot problem you may have. But before we talk about the shoe wear, we need to discuss the different types of foot problems that are out there. There is a normal arch, a low arch, and a high arch. Most people are not really sure what type of foot type they are. So an easy way to determine this is by doing the wet test. The wet test is done by taking a cookie sheet or a pan, filling it with water, and taking a paper bag or a paper towel and placing it next to it. What you would do is step into the pan to wet the bottom of your foot. You would then take your foot out of the pan and place it onto the piece of paper and get an imprint of your arch. After you take your foot up, you will look and see what kind of an arch implant picture you have on that piece of paper. And based on that picture, you can determine whether you have a neutral or normal arch, a flat arch, or a high arch. If you happen to have a normal arch or a normal pronator, you actually are lucky enough to be able to wear any sneaker, but the best thing to do is actually look for a shoe that has good stability with a moderate arch support. If you find after doing the wet test that you are actually an overpronator or you have a flat arch, there are different types of things you want to look for in a sneaker. One of the things you want to look for is a dual density support on the inner sole of the shoe. What I mean by that is that if you look on the inside of the shoe, you'll see that there's two different colors. There's the white and the gray. The gray actually has a little bit more denser material than the white. The white is softer. So when the gray is on the inside part of the shoe, it actually creates support for your foot so that when you are striking your heel and you pronate, it actually will stop you from overpronating and give you the support and stability that you need. You want to have a platform that is actually wider than the toe box of the shoe so that when you do come over and pronate, you have that support on the medial part of your forefoot. As you can see in this sneaker, this one also has the medial dual density support, the gray on the inner part of the shoe, and the white is the softer part. The other thing you want to look for is on the inside of the shoe. You want to look at the arch and how high it goes up on the inside of the shoe. You want it to go up at a medium height. You don't want it to be too low or too high. You want the arch on the inside to actually go up midway along the inner side of the shoe. The other thing you want to look for is the wide platform so that you have stability control. And the other thing you want to look at too is if you do have a pair of sneakers that you wear very often, if you want to determine what kind of a foot type you are, look at the wear on the inside, on the bottom surface of the shoe. If you are an overpronator, you're going to find that the wear of your shoe is going to be more on the inside portion of the forefoot and on the inside portion of the heel. If it is determined that you are actually a high arch or a underpronator, you will want to look for a shoe that actually has a little bit more of a neutral cushioning in the midsole of the shoe, a softer midsole to accommodate the supination or the high arch, and also a softer midsole to encourage pronation. The other thing you want to do is you want to look for a heel that has a little bit more shock absorption, because when you are a underpronator or a high arch, when you hit the heel, when the heel strikes, it actually creates too much shock and then you have a tendency to roll out. So what you want is a heel that actually has a little bit more softness to it, a little bit more cushioning, so that when the heel strikes, there's a little bit more shock absorption, and it'll encourage that pronation that's required for shock absorption when you're running. If you are an underpronator or a high arched runner, you will see that your wear on your shoe will actually be on the outer portion of your heel as well as the outer portion of the sole of the foot. On the inside portion of the shoe, when you're looking at the arch, you actually want the arch to be a little higher up the inside of the shoe to actually support your arch when you're running or walking. People sometimes think that this arch should not be that high if you do have a high arch, but actually you do need the support when you're a supinator. Some additional tips that I'd like to share with you today is that when you are looking into sneakers, I want you to replace your sneakers every 6 months, unless you are a runner, and then you need to replace it every 4 to 6 months. When you are buying your sneakers and you're worrying about the width of the shoe, don't look so much at the heel width. Base your width more on your forefoot so that it accommodates your toes, because you don't want overcrowding of the toes. The other thing I want to suggest to everybody is that when you are looking for a sneaker, look for a cross trainer or a runner. Those will give you the best support as opposed to a walking shoe. Final tip that I would like to share with you is that when you are trying on your shoes, make sure you try them on at the end of the day as opposed to first thing in the morning, in case there's any swelling or accumulation of fluid in your feet at the end of the day, and you'll have a better fit. Two brands that I feel are probably the best to look for in a sneaker are your Asics Gel Foundation or your New Balance 1226. These are the best for motion control. I also feel that the Brooks shoe also makes a very good stability sneaker. If you are a supinator or a narrow foot, Nike is probably your best bet. Thanks for tuning in, and if you have any questions or concerns, you can contact us at our website at physicaltherapyandbeyond.com.